Hello everyone, I am Dr. Emine A Rahiman, Assistant Professor in the Department of Pediatric Oncology at Kasturba Medical College and Hospital, Manipal. Today I am going to brief about childhood cancer survivors, their challenges and their lives. So as we all may be wondering, do children with cancer survive? Yes. They have excellent chances at survival. Out of 10 children who are diagnosed with cancer, 8 of them survive once the treatment which is required for them is completed. So what do we mean by survival, and when do we tell that a child with cancer is cured? So suppose a child finishes treatment, the child has to follow up for a minimum of at least 2 years, and after that most of the centers and most of the oncologists would believe that the disease is gone or the child is cured. In some places, some oncologists also take a time point of 5 years from the time of diagnosis to say that the child is cured of cancer. Now, after a child undergoes treatment for cancer and then the follow-up period of 2 years is finished, still does it require that the child has to come to a center for follow-up? Yes. So, a child with cancer after finishing his or her treatment has to be under regular follow-up. Ideally, it is recommended for lifelong, but at least up to a period of 5 years is required. Then we may wonder why it is so, because although children with cancer after fighting and surviving can lead a very normal life, finish their schooling, complete their education, go to married life and have children, they may have certain issues when compared to their normal peers. So what are these problems which we are anticipating in children with cancer? These problems can be secondary to the treatment given or because of the disease which they had. It could be physical or health challenges, like they have higher risk of having chronic health conditions, for example cardiac issues, metabolic issues, endocrine issues. They could be having some psychosocial challenges. Their mental health can be disturbed because of the disease, because of the treatment which they received and of the adjustments which they had to go through while the treatment was going on and back in the community. So looking into their mental health is very important. Then as most of the children who fight their cancer are young, they still have a long duration of education and schooling ahead of them. So we need to monitor how they are performing in their academics, how well their schooling is happening, and if any issue arises, we need to intervene quickly so that it does not affect their education. So all in all, it is not that only the child goes through all these issues. Children with cancer, the family as a unit also has to go through so many changes during diagnosis, during treatment and later in follow-up. So it is impossible to identify all these challenges unless a child comes for follow-up. So it is recommended that until at least 5 years of completion of treatment, children are physically seen in the centers where treatment is done, and later on at least a telephonic follow-up to ensure that all is good. So how do we go about giving all these services to children and families who have fought cancer and survived? So this is in the heading of Survivourship Clinic. So Survivourship Clinic consists of a pediatric oncologist who knows about the treatment which the child has received, and along with them there will be a set of other discipline people who help deliver the services. They include a psychologist, a nutritionist, a child life specialist or an occupational therapist, a play therapist, and cardiologist, endocrinologist. So all of them are not involved in the care of all children. According to the needs of the child and the family, different specialty people are also pulled into the care of the child. So do all children who have fought cancer require the same kind of follow-up? No. So the risk of the problems which a particular child can have in the future depends largely on the type of disease the child had and the type of treatment the child received, more so on the intensity of the treatment which the child received. So depending on the type of all these factors which are variable, there is a risk-based stratified approach in dealing with these children who have fought cancer. The pediatric oncologist is the main key person who will identify the risk and tailor the kind of follow-up which a particular child requires. Now, after all this, we have to know that children will lead almost a normal life. They may require follow-up until their early 20s, 30s. And in our experience with childhood cancer survivors, they continue to teach us that cancer is just a word. It's not a sentence. It's just a part of their life. So they continue to lead a very normal, full life despite all the challenges which they go through. Thank you.